With flu season about to begin, health officials are worried more children could fall ill this year if parents used to giving their children the nasal spray vaccine opt out when they find that FluMist is largely no longer available. The Centers for Disease Control is now recommending against the use of the nasal spray vaccine, making the shot the only viable option. Joining us now to discuss are WSJ reporter Peter Loftus and Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Welcome to both of you. Dr. Offit, let me start with you. Why is the CDC no longer recommending the FluMist vaccine?
Because for the last 3 years, FluMist hasn't worked. The percent efficacy last year was about 3%, which really isn't much better than placebo. So I think until that company can figure out what happened, the CDC no longer recommends that vaccine's use.
Did it work at one point, though, and slowly became less effective?
It's a complicated question. The answer to the question is yes. Not only did it work better than the inactivated vaccine, which is why a few years ago the FluMist got a recommended or a preferred recommendation for over the inactivated vaccine or the flu shot. But what's happened over the last few years, it's been hard. It's hard to know. I think it's FluMist, the nasal spray vaccine. Is difficult in the sense that when you give a shot, you know that you're giving a certain amount of protein that's going to induce an immune response. When you give the FluMist, what happens is that virus has to reproduce itself at the nasal mucosal surface in order to induce enough protein that induces an immune response. And I think there's been a problem with those 4 strains now reproducing themselves at quantities sufficient to induce an immune response.
Right. Okay.
So they'll figure out why.
And so bottom line, no longer effective. So Peter, will the FluMist vaccine even be available? I mean, we know that the CDC says it doesn't work, so don't use it, but will it even be available in the U.S.?
Yes, in a very limited supply. The manufacturer, AstraZeneca, said that they're going to make, I think, a little over 4 million doses available to healthcare providers that request it, despite this recommendation. And they said that they would make sure that the people who request it know that the CDC is recommending that it not be used for this flu season.
And so, Peter, what about outside of the U.S.? Can you explain why it is still considered effective in at least some parts of Canada?
That's a good question. I think that, I think every country has their own surveillance network, so to speak, where public health officials try to monitor how well different flu vaccines work in given flu seasons. Mm-hmm. And I think these other countries have just reached different conclusions. And there have been multiple studies that track FluMist, and not all of them have found as low an effectiveness rate as really the pivotal studies that the CDC is relying on.
Okay, the bottom line for parents here in the U.S., Dr. Offit, have you heard from some parents who tell you they are reluctant to vaccinate their children this year because their children don't like needles?
Well, that's definitely true. Although FluMist represents only about 8% of the U.S. market, it represents 33% of the pediatric market. So sure, there are going to be kids who don't get vaccinated this year. And frankly, to be honest with you, I think it's unethical for the company to make FluMist available coming off the last 3 years of failed efficacy. And though the Canadian data were different, you have to consider the fact that Canadian vaccine is different than the vaccine we use in this country, and that it has 3 strains, not 4. And I think the addition of the 4 strain may have been that problem. So right. I think they shouldn't be doing what they're doing.
And so, Doctor, you say despite what the CDC says about FluMist, it's very important to give your child the flu vaccine, the shot then at this point?
Sure. I mean, every year, a couple 100,000 people are hospitalized with influenza. 20 to 35,000 adults will die of influenza every year, and about 75 to 150 children, many of whom were previously healthy, will die of influenza every year. So yes, I think although the vaccine is about 65% effective, it isn't perfect. It's still better than 0%, which is what the effectiveness is if you don't give the vaccine.
Absolutely. And beginning at what age can children safely get the shots?
6 months of age. 6
months of age. And before 6 months of age, there is no vaccine available then?
That's correct.
Okay. So, Peter, is there any chance an efficient nasal vaccine will be available again soon? Are they working on making it more efficient?
They're trying. Yeah, AstraZeneca said that they're trying to figure out what the problem has been, and that they're hoping that they develop a new version of one of the strains to include in the vaccine that would allow it to be recommended for next year's flu season. But we'll have to see what the results are.
Absolutely. All right, Dr. Offit and Peter Loftus, thank you both for that.
Thank you.
Thank you.